are going to go into the child's pose. With the child's pose, you're going to go into quadruped position, and you're going to lean back as far as you can, reach forward, and stretch. You're going to stretch your thoracic region, and you're going to hold this stretch for at least 15 minutes, okay? And come back up. Obviously, we're not going to go through the whole 15 seconds. I'm so sorry, guys. Not 15 minutes, 15 seconds. So we're going to hold this for 15 seconds and come back up. You're going to do at least 5 of these the child pose, okay? Welcome in, everybody. Welcome in. Let me know if you can hear me. Welcome in. Say hi, say hello, subscribe to the channel, because I'll be doing this every morning, okay? I'll be doing stretching, exercising to get in shape. By the way, my name is Alicia. I'm a physical therapist, and I'm 53 years old, and I am into fitness and you name it. Anything health, you name it. So we just did the child's pose. Now, we're going to go into the world's greatest lunge. So you're going to bring one leg out, one leg back, you're lunging, and with this hand, the hand that's closest to the leg that's up, you bring the elbows down to the ankle and stretch up. You're opening up your thoracic spine. This is for thoracic mobility. Elbow to the knee, elbow to the ankle, and reach up. And then you're going to switch. Elbow to the ankle and reach up. Elbow to the ankle and reach up. And that's opening up your thoracic spine. So you're going to be doing this, alternating each leg, left, right. You're going to do this for, again, about 15 seconds, holding that stretch. All right, next thing we're going to do is thread the needle, okay? So thread the needle. It's almost coming up from the child's pose. And you're going to thread the needle, opening up that thoracic spine, and reach up. Thread the needle, stretch, stretch, stretch as much as you can. Oh God, that feels so good. And reach up. And you're going to do this on each side, 10 repetitions. Can you, okay, you can hear just fine. Okay, beautiful, fantastic. So guys, again, today's just my second time going live. Last night I quickly went live just to see what YouTube was like going live. I normally go live on TikTok. So this is actually my second time going live doing an actual class, okay? All right, so we just did thread the needle, world's greatest lunge. We're now gonna do a hip flexor lunge, okay? So this is a hip flexor lunge. And you're stretching out your hip flexors, holding that pose, holding it right there, stretching your hip flexors. Very important. And you're holding it for like 20 seconds, okay? And then you switch. Stretching out that hip flexor, holding it, holding it, holding it for about 20 seconds and switch. You're going to do 10 on each side, 10 on each side. So now we're going to go into the lumbar rotation, okay? Very important that we learn to stretch our lumbar region. So we're going to go into the lumbar rotation. You're going to take one leg and bring it over. Keeping your upper body, guys, you're not turning your upper body with the leg. You're bringing the leg over, the shoulder remains on the opposite side, and you're stretching your lumbar spine. Every exercise, every stretch you're doing for 15 to 20 seconds, okay? Cross that leg over, and you're stretching the lumbar spine. Welcome in, everyone. Welcome in. My name is Alicia. I'm a physical therapist for over 26 years. I'm 53 years old, and I've been doing content for people who are 40 and over to increase bone density, increase muscle mass, And ladies, some ladies are afraid of putting on muscle, but I'm here to tell you that muscle is important. If you want to live an independent life as you age and as you get older, muscle mass, bone density is number one. Okay? All right, let's go into the piriformis stretch. The piriformis stretch, it's a muscle. The piriformis is a muscle that's deep in our glutes, right? And that muscle usually gets pretty tight. And when that muscle gets tight, it can affect our sciatic nerve and cause sciatica. So it's very important that we do our stretches and our piriformis stretch to relieve that tension on the sciatic nerve, okay? And also help with our lower back pain. Zoomed 365, welcome, welcome. Oh, thank you, Cody. Thank you, Cody. I work hard for it. Manon, welcome, welcome. Say hi, guys. Psychotic nerve, no, not psychotic, not psychotic. It's called piriformis. It's a piriformis and sciatic nerve. You have the piriformis muscle and the sciatic nerve. Have you ever heard of people saying, "Oh, I have sciatica"? The sciatic nerve is a long nerve that comes from our lumbar spine all the way down to our leg. And that's one of the largest nerves in our body. Okay. So, yeah. Okay. If you're new here, just type new. Let's get the conversation going. So, let's get into the piriformis stretch to relieve that sciatic pain. Okay. All right. So, with the piriformis stretch, you're lying on your back. Cross one leg over the other. The leg that's on the floor, you're going to pick it up, hands by here, and you're pulling. Now, where are you feeling it? You're feeling it in the opposite hip. Okay, let me demonstrate on the other side. So, cross this leg over, thread the hands through, grab that leg right behind the knee, and you pull. And where you're feeling it is right here. Okay? Your piriformis muscle is deep in here. And you're holding the stretch, as I said, for 15 to 20 seconds. Okay? Ideally, a stretch should be held for 30 seconds. But I just want to show you guys that you have time for this every single day. I have all the lights in here, so it's very warm. Okay, so that's another stretch. I'm going to show you another stretch. It's called the high plank to downward dog. Okay, high plank to piriformis. I had double piriformis and horrendous sciatica. That pain is for no one. That pain is terrible. Chuck, that pain is terrible. Now, as I said, I'm a therapist. So most of my patients that I have, I would say 90% of my clients, my patients, they have back pain, sciatic pain, back pain, you name it, because we don't stretch. Okay, guys? And I have work today. So I'm just showing you these stretches that you can do every single morning before you go out to work. Okay. We have to stretch our bodies, guys. Okay. Okay, Chuck, welcome in, Ronnie. Welcome in. If you guys are new here, please type new and subscribe. Okay. Like and subscribe to support. Okay. All right. So we're going to go into, I just did the piriformis stretch. And we're going to go into another stretch, okay? We're going to go into the high plank to downward dog. So, high plank position. I want to make sure you guys can see this. Hang on. So, we're going into high plank position. Sorry, guys. I want to make sure you guys can see everything. So, high plank position and downward dog. Can you guys see? No. High plank to downward dog. With the downward dog, guys, make sure that your heels are touching the floor, okay? So high plank position to downward dog. High plank position to downward dog. And in this position, you can start stretching your calf muscle. Pushing down, stretching those calf muscles. I'm currently going to spinal decompression therapy. It is awesome. I just found your channel today. Looking forward to doing these exercises. Absolutely. Yes, Chuck. Looking forward to having you too. Um, Give me 1 second, guys. Let me plug this in. One moment. If you guys take a look at my channel, I have several exercises. I have a lot of educational content too. Subscribe. Thank you so much for the subscription. Thank you, guys. You feel it. Did you do that, Lick Mag? You feel it. Big. Stephen says big bottom. No, Stephen. No, Stephen. I think it's just in proportion. Just in proportion. Okay, let's do this again. We're going to go into the high plank. We're going to do the high plank into the downward dog. Okay, we're going to do this again. So, high plank, downward dog. High plank position. Tighten the core, guys. When you're doing this exercise, make sure that your core is tight. Make sure that your bottom is not up here, okay? High plank, you're tightening your core, you're squeezing your glutes, and then you go into the downward dog. High plank to downward dog. Okay, so guys, we did quite a few exercises or quite a few stretches here. I'll quickly go through them before I log off because I have to go to work, okay? Welcome, welcome. Hi, Pooh Bear. Welcome in, guys. Welcome in, welcome in. So I'll be doing this every single morning. Today is my first day doing exercises in the morning with you guys, but I'll be doing this. I'll be setting up a program, setting up a plan, and I'll be doing this every single morning. I have to set up a time. It's going to be earlier than this. It's not going to be at this time. It's going to be earlier than this, okay? All right, quickly, let's go through everything. We did the child's pose. So the child's pose, you're on all fours, quadruped position, and we stretch it out. Reaching those hands as far as you can and stretch out your back, stretch out your spine, especially your thoracic spine. And from the child's pose, we went into thread the needle, thread the needle. So that's 2. We went into the child's pose and thread the needle. Then we're going to go into the lunge, world's greatest lunge, where we bring this elbow down to the ankle and we open up our thoracic spine. Elbow down to the ankle, open up thoracic spine. Always remember to do it on the opposite side. Elbows down to the ankle, open up the thoracic spine. 10 on each side, okay? Then we went into our hip flexor stretch. We did our hip flexors, stretching our hip flexors right here, holding it for 15 to 20 seconds. And then we went into our lumbar rotation. Holding that pose, you're stretching out your lumbar spine. The most difficult area, people have most difficulty with the lumbar area, and that's because that's what's carrying most of our weight. Our L4, L5 carries most of our weight through our spine. Lumbar rotation, lumbar stretch. Then after that, what did we do? We did the piriformis stretch. So piriformis stretch, very important. Let me show you from this side. Cross this leg over, thread the hands through, grab the leg, and you pull. And where you should be feeling it should be right here, right where the piriformis is. And then last but not least, what did we do next? No, that was it. We went through all of those. We went through about 7.